We begin this hour with the developing news around the potentially deadly coronavirus. China has revealed the virus has now infected nearly 6,000 people. It's killed 170. Let's look at home. The number of confirmed cases has risen to 7. Overnight, authorities in Queensland confirmed the first case had been detected in that state, a 44-year-old Chinese national in isolation in the Gold Coast University Hospital. In Victoria, a second case of coronavirus has been confirmed. Those cases are in addition to the 4 already identified in New South Wales. Today, the Health Minister has also confirmed that Australians, 2 of them in China, have contracted coronavirus.
2 Australians did contract the virus in Guangdong province. They have been treated, and the advice that I have, and I would want to be cautious on this, is that they have been released and are not seeking consular assistance at this stage.
Meanwhile, the federal government's defending its plan to use Christmas Island as a quarantine zone for those Australians trapped in the epicentre of coronavirus. China is yet to approve the evacuation mission. Some in Wuhan are reluctant to take part anyway.
Under threat from the deadly coronavirus, around 600 Australians stranded in Wuhan are weighing up whether to leave.
My family and I are discussing the pros and cons about it. I think that the main concern that I have, and I feel as the whole of us over here would have, is the lack of transparency.
Offered a way out by the federal government, a Qantas flight home, but first they'd need to spend 2 weeks in quarantine on Christmas Island. Medical facilities upgraded at the detention centre last year amid coalition concerns the Medivac laws would see a surge in boat arrivals.
Okay, well, this looks pretty much as I remember.
The hospital and facility now sit empty, but a fortnight stuck in a detention centre is causing concern for those deciding their next move.
You know, it being a detention centre is obviously a put-off, and I'm just not quite sure how effectively or how professionally we can be quarantined.
I just don't have an empty hospital sitting around. I can't move people out of Royal Brisbane Hospital. We've looked at different facilities, and this, in our judgment, is the best.
The Australian Medical Association disagrees, slamming the move as inhumane.
There are many more humane options on mainland Australia.
This is a humanitarian mission, but no state or territory, to the best of my knowledge, has offered to clear out any of their hospitals.
While Labor is questioning the motivation for using Christmas Island as a quarantine zone, suggesting it could be a way to save face after the government spent $185 million reopening the facility last year.
They need to be seen to be doing something at Christmas Island other than holding a press conference to Scott Morrison.
Other countries, including the US, have already been granted permission to evacuate their citizens from Wuhan, but Australia is still locked in delicate negotiations with Beijing.
I would have thought it happens fairly quickly, and those conversations already are underway.
As the death toll from the coronavirus rises, major airlines, including Air France and British Airways, have announced they're suspending flights to and from mainland China. Qantas now considering whether to follow suit.
Qantas is well informed by their own medical experts.
Eliza Edwards, Sky News, Canberra.